Hi, my name's Ellen. I'm currently a final year Monash student on placement up here in Bendigo. I've been an ERC student throughout the course. Initially, when I first applied, I didn't know very much about the ERC program. So I was actually lucky enough to swap into the program at the end of second year and spent my third year up here in Bendigo, fourth year partially in Mildura and partially in Castlemaine doing GP. So the main reason I chose to swap into the rural program is because I'm from a rural background and in the future I'll probably likely be working in a regional area. So it sort of made sense for me to do part of my training in a regional area as well. As part of the ERC program, all students come back to either Bendigo or Mildura for 2 rotations in final year. I wanted to come back in final year mainly so that I could firstly get the access to all the hands-on experience that will be really useful for internship year next year, and also so I could get references from some of the Bendigo health consultants that I've met in the past in order to help me get a job for next year as well. The best thing about the rural program for me is largely the more social aspect of it. I've never lived in Melbourne prior to the first 2 years of medicine. And for me, a regional town is a lot friendlier, there's a lot more access to community activities, and you become really close friends with the other cohort of students in town as well. I think in terms of teaching in the hospital, it was a better fit for me. You get a lot more one-on-one personal time with the consultants and registrars and junior doctors. And for me that helped a lot because I enjoy learning in a hospital environment rather than a tutorial or lecture-based environment. I think the worst thing about being in the regional areas is a bit of a disconnect from what the metropolitan students might be doing, in particular in the lead up to exams, for fourth year exams in particular, when there's a lot more revision tutorials that are done in Melbourne that we don't necessarily have easy access to up here. I suppose to overcome that, we did get to have the opportunity to video conference into some of those sessions, but a lot of rural students also compensate because they know that's an expected thing to happen. So when I was up in Mildura, that's the most isolated you could be. We did a lot of independent study outside of the hospital environment on our own, and as a result rural students tend to get really good marks each year regardless of the added advantage of being close to Melbourne. I haven't done much metropolitan hospital placement, so can't really compare that much between Bendigo and Mildura Hospital compared to a lot of the city hospitals that my peers have been to. All I can say for myself is that I've loved every moment of our hospital placements up here, and have really especially enjoyed the community environment surrounding the hospital here in Bendigo in particular. All the students live together at the Monash University accommodation, and we have formed really strong bonds which I'm sure will carry on for years and years until we're specialised. I'm interning here in Bendigo next year as my first preference. I suppose it did obviously help me with getting my internship job here, as my references were from Bendigo and I knew the members of the interview panel when I was interviewed here. Being back here again now at the end of the year will make it a really hopefully seamless transition into internship early next year, and it'll definitely help me throughout the year as I already know the hospital and know the doctors.